I'm Kevin Berger. Stroke is one of the leading causes of death in the United States and the leading cause of long-term disability. May is Stroke Awareness Month, and the American Heart and Stroke Association is working to make certain everyone knows the warning signs and is ready to take action. Dr. David Anderson, a neurologist and stroke expert, is here to tell us about their efforts. Dr. Anderson, welcome to Newsmakers.
Thank you.
Tell us just what is a stroke exactly? What happens when someone has a stroke?
Well, a stroke is a sudden brain injury, and it's due to vascular trouble almost always. And the leading or most common mechanism of vascular trouble is when a blood vessel becomes occluded or clogged up, and the area of brain that it serves is injured and on the way to death. And that produces symptoms which are often weakness or numbness or speech difficulty.
I'd like to avoid that. What are there things that people can do to lessen their chances of ever having a stroke?
Again, that's the best route, is to avoid it altogether. The most direct way of doing that is dealing with risk factors that you might have that are amenable to your intervention. And probably most important of those is high blood pressure. Smoking is right up there. Having good control over your diabetes, if that's a problem that you have. Having your cholesterol under good control. Keeping fit, and keeping your weight down. All very important and will reduce your risk of having a stroke.
In your practice working with people who have had strokes, do you see people who, if somebody around them would have known how to take the correct action, that maybe the effects of the stroke would have been less?
Yes, unfortunately we see that very commonly. Hopefully less commonly now than in a few years back, and hopefully in the future it'll be even a better situation. But yes, we find people that don't come to the hospital in time. When they've had a stroke, and we of course see lots of people that don't pay attention to their risk factors and take the opportunity to prevent the stroke in the first place.
How would you know if someone is having a stroke? What do you look for?
It's a little different than heart attack, and one of our obstacles is the lack of a dramatic symptom that gets your attention, like having chest pain. There is no pain related to the onset of stroke. Probably the most common symptoms are weakness or numbness of one side of the face, weakness or numbness of one arm, difficulty with speech, slurring, for example, or saying nonsense words. If those happen, and that's part of an acronym that the American Heart Association is trying to have everyone remember, F is for face, A is for arm, and S is for speech, and T for fast is for time. And the time is critical between the time your symptoms onset and the treatment that the doctor can give to dissolve the clot and save that area of brain that is in danger. So
when we say, act promptly, what happens if you don't? I mean, what difference can the minutes make?
The first 3 to 4 hours is a golden time of opportunity, a window of opportunity to restore that area of threatened brain by opening the blood vessel that has become occluded. And once it's gone, our chances of bringing you back to a normal state are much diminished. So,
a rather dire warning, but maybe we've given people the reason to not take that chance and to dial 911?
Dial 911. That's the answer. Absolutely the answer.
Thank you so much, Dr. Anderson. You can learn about the warning signs of a stroke and what to do in the event of a stroke by visiting strokeassociation.org or the American Heart Association's website at heart.org. And that's it for this edition of Comcast Newsmakers. I'm Kevin Berger. Thanks for watching.